Chapter 15, Health Psychology. In this chapter, we're going to outline some of the psychological factors and how they relate to general health, how they contribute to some specific health diseases, and how interventions might help to improve different health-related behaviors. We're going to finish the chapter by talking a little bit about sleep and health. So, health psychology is a field that explores how biological, psychological, and social environmental factors interact to influence physical health. It's also called behavioral medicine. Biopsychosocial approaches help to understand our physical health. Give you a little bit of an idea about how a biopsychosocial approach can help understand our physical health. Here's a chart that talks a little bit about some of the role that genetics plays in our susceptibility to diseases and how social and environmental factors can directly impact health. Health psychology has grown rapidly in the last decade. In the 21st century, the 5 leading causes of death are diseases that are actually influenced by psychological and social factors like smoking, diet, and stress. So obviously a biopsychosocial approach becomes really important in us understanding how these social and environmental factors can influence our biological vulnerabilities. Let's take a look at some of the psychological factors and how they impact health. Our ability to be resilient or fragile really changes the way that people apprise their situations and interpret events. And that can have significant outcomes for their health. So pessimism, the tendency to see negative events as being your fault, or negative events will continue in the future and have consequences, has certain implications. So pessimism causes an arousal of the body's fight or flight response, and this chronic arousal of the body, the chronic arousal of the fight or flight response system in the body, can have physiological damage, can cause physiological damage. Pessimism can contribute to poor health outcomes. It can lead to people engaging in very unhealthy lifestyles and habits, and it can reduce positive coping strategies. Coping strategies are how we cope, and how we cope affects our health. So this is another set of psychological factors that can have an impact on our health. When one engages in avoidance coping, which means they're denying that one is ill or facing other obvious stressors, this can be linked to severe health issues. It can predict chronic diseases and mortality. There's also gender differences in how men or women respond to stress and how we respond to stress differently. So here are the gender coping styles or tendencies rather for women, and these are for men. So for women, we see physiological changes that are associated with the fight or flight response are less prominent in their coping style. They generally seek more support from others, and they have larger social networks. They are emotionally, cognitively, and physiologically sensitive to marital conflict. On the flip side, men have a much smaller network of people that they turn to for support. They're less likely to share personal issues or concerns with others, and they're actually less likely to benefit from the physiological factors or benefits we see from relationships. There's also cultural differences in how individuals and how different cultures have different norms for coping with stressful events. And the way we cope are obviously influenced by our social norms. So some examples of this is people from Asian cultures are generally reluctant to reach out to others for social support. They rather find ways to benefit from their social networks that don't necessarily involve revealing their personal concerns. European Americans, on the other hand, can be much more explicit, and they form much more explicit support from others, and they often extract that support by revealing personal concerns. There's some psychological disorders and how they influence physical health. So it should become no surprise to you that psychological disorders, or people with mental disorders, result in physical health problems as well too. Individuals with psychological disorders have higher rates of poorer physical health and physical health outcomes. There's a pool of researchers that believe psychological disorders and poor health outcomes share some common genetic causes, that psychological disorders can have a common genetic cause with medical illnesses. So, for example, depression and cardiac disease, they both seem to involve dysfunction in the serotonin system. Psychological disorders may create medical disorders, and vice versa. Medical disorders can create subsequent psychological disorders. The interactional direction is not clear. We're not sure which causes which, but we definitely see a correlation and relationship between the two in a bidirectional way. Psychological disorders can cause, obviously, stress in a personal or professional life. It can lead a person to become more pessimistic. And psychological disorders, individuals with psychological disorders are more likely to engage in negative health habits like smoking, and they're less likely to engage in positive health habits, as in exercise. Some of the psychosocial factors in specific diseases. We know the immune system is significantly impacted by psychosocial factors. The immune system protects us from diseases by identifying and killing pathogens and tumor cells. There's two branches of the immune system, the innate immune system and the specific immune system. The innate immune system reacts quickly and automatically and non-specifically to any microorganism or toxin in the body. So it activates the entire system. The specific immune system is a slower and more specifically tailored response to pathogens, and the specific immune system is much more affected by chronic stress and negative interpersonal events. Some studies actually point to increased rates of cancer. They show quicker progression of HIV and AIDS symptoms. They show an increased rate of coronary heart disease, as well as hypertension. That's directly believed to be a result of psychosocial factors impacting one's immune system. I'm going to skip over some of the specific health conditions that are reviewed in this particular chapter. You're welcome to go through them and get a sense of really what is the origin or the etiology of each medical disorder and how we see the relationship to psychosocial factors. I wanted to talk a little bit about improving health-related behaviors. Obviously, if we can improve health-related behaviors, we can impact more positive physical health. So guided mastery techniques are the first set of health-related behaviors I want to talk to you about that psychologists often teach individuals that have physical health disorders. These target self-efficacy beliefs, right? They target beliefs about one's own purpose, one's own beliefs about themselves, almost as if they target one's own self-confidence and ability to believe in themselves. They provide information on how to engage in more positive health-related behaviors. And they also increase skills related to those positive health behaviors. So they may increase their beliefs to engage in positive health behaviors. They may also increase their desire to want to engage in such. One has to remember that participation in guided mastery techniques can be influenced by cultural norms. So we have to understand this. We have to understand that there are some cultures that are highly resistant to these types of self-efficacy changes. And understanding this and identifying ways to overcome it are important in engaging people in treatment. There's also a number of internet-based health interventions that might help to improve health-related behaviors and outcomes for individuals. These are generally delivered to individuals who cannot access in-person programs. And we know millions of people gain information from the web every single day. Providing health-based interventions over the internet provides a very low cost. It provides things at very low cost. For example, you might be able to provide an exercise or nutrition program to a large segment of the population at little to no cost. And the potential public health impact of these programs is great because you're reaching a larger audience, and you're particularly reaching a younger generation that has a much more increased level of comfort in the web and the internet system, and frequently looks to that system to answer a number of issues and to gather information on a number of topics. Sleep is also really important to one's health. Getting enough sleep is critical, really, to one's health. And those who sleep less than 6 hours per night have a 70% higher rate of mortality. That's 70%. So chronically over one's life, sleeping less than 6 hours per night increases your mortality rate by 70%. There's other consequences of sleep deprivation. We already talked about poor health. The belief is that the lack of sleep weakens one's own immune system, which leads to poorer health and more frequent episodes of illnesses. There are psychological effects, too, of a lack of sleep. It can impair memory, learning, logical reasoning skills, math skills, complex verbal processing, and decision-making ability. Emotionally, it can leave somebody very irritable, experiencing up and downs, perceptual distortions, and at times mild hallucinations. You might be surprised to hear that sleep in some instances can cause death. Think about this fact. About 20% of all serious car crashes are due to actually driver sleepiness. And obviously we know that sleep is affected by stress as well too. I'm going to talk a little bit about some of the sleep disorders that you might find in the DSM. Again, we want to be really clear about when we begin to diagnose sleep disorders, and much like all the other psychological disorders, you want to look for a significant impairment in one's functioning and their ability to engage in their daily life skills. Sleep disorders can be thought of as disturbances in sleeping or staying awake. There's many causes to sleep disorders. You can have a psychological disorder. So in some instance, for example, insomnia is a symptom of many psychological disorders, including depression, and often occurs as well with attention deficit hyperactivity disorder, or ADHD. A disruption in sleep can also be a physiological effect of a medical condition. We know that many medical conditions cause disturbances in sleep. It can be a result of a chronic use of a substance, and there's actually a diagnosis in the DSM where your sleep disorder is solely induced by the use of a substance. Insomnia is one of the most popular and most familiar sleep-wake disorders that we're going to talk about. And insomnia is defined as a chronic difficulty in initiating or maintaining sleep, or sleep that does not restore energy and alertness, and it can lead to clinical significant distress as well as impairment. Insomnia must occur at least 3 nights per week for at least 3 months for us to be considering it in the realm of a diagnostic area. Everybody experiences episodic insomnia, where they have difficulty falling asleep or staying asleep. And actually, in most studies, at least 50% of adults report episodic insomnia. The difference, however, with episodic insomnia is it only lasts a few days, it's an isolated occurrence, and it's usually tied to a specific stressor. It's usually triggered by a major stressor. There's treatments for insomnia disorder. They generally are grouped into three main approaches: cognitive behavioral interventions, sleep restriction therapy, and then drug therapies as well. I want to talk about the hypersomnolence disorders and narcolepsy. The hyposomnolence disorders is the excessive sleepiness. It's expressed as an excessive quantity of sleep or a low quality of wakefulness. So these are folks that are chronically sleepy and sleep for very long periods of time. This is separated from regular adolescence, where that happens a lot. Hypersomnolence disorders are usually reserved and diagnosed in adults. Narcolepsy is a recurrent attack of sleep, the irresistible need to sleep. Narcolepsy is a pretty common disorder in that it's portrayed a lot in TV and social medias. But it's where someone just quickly lapses into sleep or naps, occurring often, frequently, multiple times within the same day. When you have narcolepsy, you also must have and experience cataplexy, which is a sudden loss of muscle tone lasting for under 2 minutes. So you might notice that those with narcolepsy may suddenly drop objects, fall to their knees, they suddenly crash into quick sleep. We're going to move forward and talk a little bit about the disorders of arousal. So disorders of arousal can be categorized into three types. Disorders of arousal all share the commonality of that these are recurrent episodes of incomplete awakening from sleep that seem to mix elements of wakefulness and non-REM sleep. So they differentiate from some of the other disorders that occur during REM sleep. So before insomnia, we talked about really sleep disorders and that the lack of sleep. In disorders of arousal, we talk about disorders in which people are awakened frequently from sleep. So the first type we want to talk about is sleep terror disorders. This is usually fairly common in children, where a sleeping child screams, sweats, and has increased heart rate. They feel their heart is racing. And often the child, unfortunately, cannot also be easily awakened. Second type of disorder of sleep arousal is sleepwalking, where this is repeated episodes of rising from bed during sleep and just walking about. The third type is confusional arousals. These are episodes of incomplete awakening during non-REM sleep. They usually do not involve sleep terrors or sleepwalking. Individual is usually talking, confused, and often doesn't make sense. Like we do every chapter, I'd just like to finish and kind of reiterating the fact that the disorders that we're talking about in terms of sleep, as well as some of the health disorders we reviewed in this particular chapter, we see, as we've seen in many other chapters, really the reciprocal effects of the psychological, social, and environmental and biological factors, and how they interact with each other in influencing the development of a disorder. Thank you for listening to Chapter 15.